Hello everybody, my name is Andrea Rivera and I am a Pediatric Emergency Medicine Fellow at Cardinal Glennon Children's Hospital. As we all know, bronchiolitis is the most common cause of emergency department visits and hospitalizations among children younger than 1 year of age, incurring in over 150,000 emergency visits and hospitalizations annually, and exceeding over $1.7 billion in combined charges. The updated publication of the American Academy of Pediatrics guideline on diagnosing, treating, and preventing bronchiolitis in 2014 has made certain recommendations which has caused some degree of controversy in acute management of these types of patients. Since then, there has been significant variability in the acute management and treatment of bronchiolitis. Overall, the objective of the AAP guideline is to assist physicians in patient decision-making about appropriate care utilizing evidence-based medicine, not reducing or replacing clinical judgment in diagnostic and therapeutic choices. However, little is known about physicians' views on these guidelines, how often and under what circumstances they are used, and how physicians decide which components of the guideline they will use for a particular patient. Previous studies have shown that the emergency department is a site commonly associated with higher rates of diagnostic testing in children seen for bronchiolitis. Other studies in the meantime have shown that physicians in the pediatric ED tend to deviate from recommendations within clinical practice guidelines. But there are no current studies that elucidate on the reasons that affect physician decision-making about the use of bronchiolitis AAP guidelines. As part of my research, I am conducting a survey to assess physicians' practices, attitudes, and beliefs about the AAP clinical practice guideline on bronchiolitis. The objective of the survey is to learn about physicians' beliefs on the diagnostic and management components of the guideline on bronchiolitis and identify clinical and/or personal reasoning used when deciding whether or not to follow the AAP guideline. This study will be the first to assess the pediatric emergency physician's self-reported behavior and position on the AAP bronchiolitis clinical guideline. This may help shape future policy. The survey will be distributed through the PEMCRC and the section of emergency medicine of the AAP during the fall cycle. It is brief as it only takes less than 10 minutes to complete. I hope that those of you who are eligible will consider completing the survey when it is made available. Hope you guys have a great upcoming bronchiolitis season. Thanks for listening.